Hi, this is Mark, and this is my prostate cancer experience. Right now, it's about 24 hours after I came out of surgery, and you see me walking here down the facility. This is Dr. Samadi's private facility at Lenox Hill Hospital, and probably the nicest hospital facility I've ever seen. I keep referring to it as the hotel because it feels like the hotel. It looks absolutely amazing. But here, 24 hours after my surgery, I'm walking around. They encourage you to do a lot of walking to kind of get yourself associated with, kind of back into the shape of things again. Let me just put the camera down here so it can be a little more steady. There we go. So anyway, here's what 24 hours feels like. Notice I could sit in the chair. Last evening, it was a little uncomfortable. I managed to doze off around 10:30. They come in about 2 o'clock in the morning to take your vital signs, so I woke up for that. And it's very important to do walking. One of the problems that I'm having, which everyone has, is during the surgery, they inflate your abdomen with air. And it has to escape. Until it doesn't escape, you're going to feel very uncomfortable. So I still haven't passed that gas yet. And it's something I don't usually talk about, passing gas, but in the context of the surgery, it's very, very important. So I feel like I'm very, very full. Even if I feel my abdomen, it feels very, very tight. So the goal today is to do as much walking as possible. So hopefully I will pass the gas. That will make me feel a lot more comfortable. And then I can start eating solid foods again. So up until now, it's just been liquid foods, which is kind of a shame because the dining that they give you here at Lenox Hill Hospital and Dr. Samadi's wing, it's extraordinary. It's like being in a fine restaurant. So my family's here with me, and they've been enjoying some of those gourmet delicacies. But I've been having the soup broth, the chicken broth, which is delicious. It just needs a matzo ball; it would be perfect. Some Jello, some frozen ice, as you saw in a different video. So today, typically, when you have the robotic procedure, it's not unusual to be discharged after 24 hours. So in theory, I could be discharged today and I would go back and rest until, so today's Tuesday, I would rest until Monday. So after 7 days after the surgery, they remove the catheter and then you kind of start your ongoing recovery to regain your continence. I'm very optimistic based on the surgery results that I won't have an issue with incontinence. You'll never know for sure. But one of the things that I did leading up to the surgery is I worked with a personal trainer and made sure that my core was very well conditioned. So I spent a good 4 to 6 weeks working out 3 times a week, focusing on exercises that would sort of target the areas that the surgery is being performed around. And as a result, the surgery was a great success. So I really, really recommend that. The other thing is they're going to tell you to start Kegel exercises about a month before the surgery. And a lot of people don't do this and they suffer because of it. And the Kegel exercise, you can do sitting, standing, walking around, but basically several times a day, you just sort of, you don't clench too tightly, but when you're in that situation, you're talking to somebody, let's say in the office, and you have to pass gas, the way you hold it in, well, that's a Kegel exercise. So what you do leading up to the surgeries, you do a number of those throughout the day. You hold it for about 10 seconds. They're a little difficult at first to kind of master, but then they become almost second nature. They're very easy to do and it's not a problem. While the catheter is in for the 7 days, you don't do the Kegel exercises, but once it gets removed, you continue, and continence should return. I think in most cases, it's not really an issue. But generally speaking, on the second day, on the first day, this is 24 hours later, I've been doing my rounds. I've been doing a lot of walking in the hallway where we started this video. I've been meeting my neighbors. There's not too many people on this floor. They're all private rooms. This one I'm here is a very special one. It's almost like a family suite. When it's a little tidied up, maybe in another video, I'll give you a tour of it. But there's only men on the ward. Generally, these are all patients of Dr. Samadi. And from what I can tell, most of the gentlemen I've spoken to, because when you walk in the hallways, you kind of meet some friends. We're all in the same boat. We're all walking around carrying this bag, which is attached to the catheter, which is the first for me, but the urine is flowing directly from your bladder right into the bag. And so the good thing is you don't have to get up to go to the bathroom, but it still isn't comfortable. I don't want to give the illusion that it's a walk in the park. It's hard work, and you have to really sort of be mentally conditioned for it as well as physically. One gentleman that I spoke to, we're having the same symptoms. He's really not enjoying himself, and I'm not saying this is a thrill, but I've already conditioned myself that there's going to be some discomfort for a number of days. What I keep thinking about through this process is the outcome, and the fact is, I know Dr. Samadi did an amazing job. I know he removed all the cancer. I don't know this scientifically, but in my mind I know it. The surgery was a great success, so Dr. Samadi, he saved my life. As a result of this, I don't have cancer. So it's certainly something you don't expect at 51 years old. But there's great thrill now, and there's great joy in knowing that I have a long and healthy life ahead of me. So a little bit of this discomfort that I'm feeling right now, which will just last another couple of days, is well worth it relative to the other consequences that could have been the case. So I'm hopeful that if you're potentially a prostate cancer patient, these videos that I'm putting out there will be helpful to you. When I was looking around YouTube, I found a few, but I had wished that somebody would have documented their experience. So that's what I've decided to do in a way to help you. There's a lot of great surgeons, but I cannot speak more highly of Dr. David Samadi. I live in Miami. I flew to New York for the surgery. It's not expensive to stay here for 10 days, but you can't put a price on your life. And one visit with Dr. Samadi really convinced me that he's the only surgeon that I would ever allow this procedure to be performed on me with. There's great surgeons across the country, around the world, but when you find someone who's so committed and dedicated to his work, as well as being, I'm certainly biased, but I stand by my bias, the best prostate cancer surgeon out there. There's nobody else I think as good as he is. And so I can't stop tooting his horn. I hope he's watching this. And Dr. Samadi, if you are, I'm just very, very grateful and very, very pleasant that we're past that point and life can continue. So moving forward, I'm going to keep adding videos as the need arises. This week, I'll probably have a couple more. I do want to give you a tour of Dr. Samadi's hospital facility. It's on the 5th floor at Lenox Hill Hospital, the Upper East Side in New York. And then what I'll do is after the catheter has been removed, I'll talk a little bit about that. So there might be a video in between, but certainly after next Monday, which I think is the 15th, of November 2015. And then moving forward, this series will continue because roughly every 3 months, when I have my PSA score retested, it should come back as 0 or close to 0, which is certainly a sign that the cancer is not there any longer. And that's what my expectation is. I don't expect it to be anything but that. So keep enjoying my videos. If you ever want to talk to somebody about it, I'm more than happy to speak to you individually. You can get my contact information through YouTube. You can also reach out to me by email, and my email address is mzilbert@gmail.com. And I live in Miami. My phone number, call me anytime, 786-280-0201. So have a good day and be cancer-free.